Bones are not static, lifeless structures. They're living, constantly changing tissue. And that becomes even more important to understand after the age of 50. As we get older, especially moving into our 50s and beyond, a quiet shift begins to happen inside the skeleton. The body starts to break down bone a little faster than it can rebuild it. Over time, that imbalance can make bones thinner, weaker, and more likely to crack or break from a simple fall, or even a small twist. You might notice that people shrink a little in height, or that a relative broke a hip after what seemed like a minor stumble. Those aren't just random events. They're part of the story of bone loss that unfolds with age. The good news is that there are many things you can do, starting today, to keep your bones stronger, reduce fracture risk, and stay independent for as long as possible. Inside your body, bones are constantly going through a cycle. Cells that build bone and cells that break it down are always at work, remodeling the skeleton so it can stay strong and adapt to the stresses of daily life. When you're young, the builders are usually ahead of the breakers, so bone density increases and your skeleton becomes more robust. By about age 30, you've typically reached your peak bone mass, the strongest your bones will ever be. After that, things level off for a while and eventually the balance starts to tip. For most people, especially women after menopause, bone breakdown begins to outpace bone building more noticeably. This is partly because hormones such as estrogen and testosterone, which help protect bone, naturally decline with age. As those hormone levels drop, the skeleton becomes more vulnerable to thinning, a condition called osteopenia and eventually osteoporosis, where bones become fragile and can fracture easily. Certain risk factors make this process more intense. A family history of osteoporosis or hip fractures, being very thin or underweight, smoking, drinking a lot of alcohol, long-term use of certain medicines such as steroids, and simply not moving enough can all speed up bone loss. Sometimes other medical conditions, like rheumatoid arthritis or digestive diseases that affect nutrient absorption, also play a role. For women, the transition through menopause is a critical time. Because bone density can drop quickly in the first few years after periods stop, men are not immune either. They tend to lose bone more slowly, but they can still develop osteoporosis, especially if they smoke, drink heavily, or have low testosterone. Understanding these risks is not meant to scare you. It's meant to underline why your choices from this point onward truly matter. One of the most powerful tools you have to protect your bones after 50 is movement. Bones respond to stress in a good way. When you put healthy stress on them through weight-bearing exercise and resistance training, you send a message to the body. We still need strong bones here. Weight-bearing activities are exercises where your body works against gravity while you remain upright. That can be as simple as brisk walking, hiking, climbing stairs, low-impact aerobics, or dancing regularly. Even light jogging can help some people, though it's important to choose activities that are safe for your joints and current fitness level. When your feet strike the ground, or when your muscles tug on your bones during movement, tiny signals trigger bone-building cells to get busier. In addition to weight-bearing exercise, strength training is essential. When you use your muscles against resistance, whether that resistance is dumbbells, resistance bands, weight machines at the gym, or even your own body weight, you're not just building muscle. You're also stimulating the bones those muscles attach to. Think of simple, accessible movements: squats to a chair, wall push-ups, lifting light weights for your arms, or using a resistance band to practice pulling and pushing motions. Doing these kinds of exercises 2 or 3 times a week, on non-consecutive days, can help maintain or even modestly increase bone strength in some areas, while also improving muscle mass and balance. Strong muscles support your joints, make everyday tasks easier, and reduce your chances of falling, which is crucial, because many serious fractures occur during falls, not just from weak bones alone. Balance and coordination deserve special attention. Over time, it's common to lose some balance, especially if you've been less active, have vision changes, or take medications that cause dizziness. Balance exercises are like insurance for your bones. Simple practices such as standing on one leg near a counter you can hold if needed, walking heel to toe in a straight line, practicing gentle yoga poses, or doing Tai Chi have been shown to improve balance and reduce fall risk. A few minutes a day can make a meaningful difference. Every fall you prevent is potentially a fracture you avoid. Exercise alone, however, is not enough. Your bones also need the right fuel. Calcium and vitamin D are the 2 nutrients most people think of when they hear about bone health, and for good reason. Calcium is a major building block of bone, while vitamin D helps your body absorb calcium from the foods you eat and the supplements you might take. Without enough calcium, the body may borrow it from your bones to keep blood levels steady, slowly weakening them over time. Without enough vitamin D, even a good calcium intake may not be used efficiently. Many adults over 50 are advised to aim for around 1,000 to 1,200 milligrams of calcium per day, though the exact amount and whether you should use supplements are decisions best made with your healthcare provider. Dairy products such as milk, yogurt, and cheese are classic sources of calcium, but plenty of non-dairy options also exist. Fortified plant milks made from soy, oats, or almonds, tofu set with calcium, certain leafy greens such as kale and bok choy, canned fish with soft, edible bones like sardines or salmon, and seeds such as sesame or tahini can contribute significantly to your daily intake. Spreading calcium intake throughout the day by including a source in each meal can help your body absorb it more effectively. Vitamin D can be more challenging. The body can make vitamin D when skin is exposed to sunlight, but factors such as age, darker skin tone, living at higher latitudes, using sunscreen, or spending most of the time indoors can reduce how much vitamin D you produce. Dietary sources include fortified milk or plant milks, fortified cereals, fatty fish like salmon and mackerel, and egg yolks, but many people still fall short. For adults over 50, recommended intakes often fall in the range of about 600 to 800 international units per day, though some people need more based on blood tests and medical guidance. In many cases, especially for older adults, a healthcare provider may suggest a vitamin D supplement after checking levels, because deficiency is common and can quietly undermine bone health. Protein also plays an important role. Bones are not just mineral. They have a protein framework that gives them structure and flexibility. Getting enough protein helps support that framework and maintains muscle mass, which in turn supports and protects bones. Lean meats, poultry, fish, eggs, dairy, beans, lentils, tofu, and nuts and seeds are all useful sources. While extremely high-protein diets without enough calcium may stress bones, balanced meals that combine protein with bone-supporting nutrients are usually beneficial. The key is a varied whole food diet that includes plenty of plant foods, moderate amounts of high-quality protein, and adequate calcium and vitamin D. Lifestyle habits can strengthen or weaken your skeleton over the years. Smoking is one of the most damaging habits for bone health. Chemicals in tobacco interfere with the work of bone-forming cells and can speed up bone loss, especially when combined with other risk factors like low body weight or early menopause. Quitting smoking is one of the most powerful steps you can take, not only for your lungs and heart but also for your bones. Alcohol is another factor to watch. Light to moderate drinking may be acceptable for many people, but heavy or chronic alcohol use has been linked to lower bone density and a higher risk of fractures, partly because of direct effects on bone cells and partly because it increases the chance of falls. If you drink, keeping it within recommended limits can help protect your skeleton and your overall health. Body weight also matters. Being very underweight is a clear risk factor for osteoporosis and fractures because there is simply less bone reserve and sometimes fewer nutrients coming in to support bone. On the other hand, carrying a lot of excess weight does not necessarily guarantee strong bones and can put extra strain on joints. Crash dieting or frequent cycles of weight loss and regain can be particularly harmful, as they may strip bone mass along with fat and muscle. The goal is a stable, healthy weight you can maintain with sensible eating and regular activity, giving your bones the support and nutrients they need. Another critical piece of the puzzle is preventing falls. Even if your bones are not extremely thin, a hard fall can still cause a fracture, especially at the hip, wrist, or spine. Many fractures that lead to long hospital stays and loss of independence begin with something as simple as tripping on a rug, slipping in the bathroom, or losing balance in the dark. Taking a careful look around your home and daily habits can significantly reduce that risk. Removing or taping down loose rugs, keeping walkways clear of clutter, installing grab bars in bathrooms, placing non-slip mats in the tub or shower, and ensuring good lighting in hallways and staircases are straightforward changes that can prevent accidents. Wearing shoes with good grip instead of slippery socks, especially on hard floors, adds an extra layer of safety. Your senses and medications also influence fall risk. Poor vision, uncorrected cataracts, or outdated eyeglass prescriptions can make it harder to judge distances or see obstacles, so regular eye exams are essential. Hearing loss may seem unrelated to falls, but it can affect balance and spatial awareness, so checking hearing and using aids if needed can help. Some medications, including certain blood pressure pills, sleep aids, and drugs for anxiety or depression, may cause drowsiness, dizziness, or drops in blood pressure when standing up, which can lead to falls. Reviewing your medication list with your doctor or pharmacist and asking specifically about fall risk can help you find safer options or adjust doses if necessary. Alongside these self-care strategies, it's important to know where you stand. Bone density testing, often called a DEXA scan, is a painless imaging test that measures how dense your bones are, usually at the hip and spine. The results are typically given as a T-score, comparing your bone density to that of a healthy young adult. A T-score in the normal range suggests stronger bones. A score in the osteopenia range points to lower than normal density but not full osteoporosis. And a score in the osteoporosis range indicates a higher risk of fractures. Many guidelines recommend bone density screening for women over a certain age, especially after menopause, and for men and women with specific risk factors such as prior fractures, long-term steroid use, or very low body weight. If you're over 50, especially if you have any of these risks, it's worth asking your healthcare provider whether you should be tested. For some people, lifestyle changes alone may not be enough. If a DEXA scan shows significant bone loss or if you've already had a fracture from a small fall, your doctor may talk with you about medications that can slow bone breakdown or in some cases help build new bone. These treatments can include a range of options, such as drugs that reduce bone resorption or others that stimulate bone formation, often combined with calcium and vitamin D support. The choice of medication depends on your overall health, your fracture risk, and how you respond to treatment over time. The goal is to lower the chance of future fractures and keep you active and independent. Putting all of this together into your daily life might feel overwhelming at first, but it becomes much simpler when you think of it as a short checklist. Move your body in ways that challenge your bones and muscles most days of the week. Aim for brisk walking or other weight-bearing activities, and include strength training at least 2 or 3 times weekly, tailored to your abilities and any medical conditions. Nourish your bones by eating a diet that provides enough calcium, vitamin D, and protein. And talk with your healthcare provider about whether you need supplements or blood tests to fine-tune your plan. Protect your skeleton by avoiding smoking, limiting alcohol, and keeping your home and routines fall safe, with attention to vision, hearing, and medications. And check on your bone status with proper screening and medical advice, especially if you're over 50 or have known risk factors. It's important to remember that it is rarely too late to make a difference. Even if you've already been told you have low bone density, the steps you take now can still slow further loss and reduce your risk of fractures. People who start moving more, eating in a more bone-supportive way, and making their homes safer often feel stronger, steadier, and more confident over time. You might notice that climbing stairs becomes a little easier, getting up from a chair requires less effort, and you feel less afraid of falling. Those small victories add up to a greater sense of independence and quality of life. Every walk you take, every healthy meal you choose, every cigarette you don't smoke, and every simple home change you make is a vote for stronger bones and a more active future. You don't have to transform everything at once. You can start with 1 or 2 changes, perhaps a daily 20-minute walk and adding 1 calcium-rich food to each meal and build from there. Over months and years, those choices become the foundation of a skeleton that can better support you through the second half of life. Your bones have carried you this far. With some attention and care, you can help them stay strong for the years to come. Thanks for watching.